Hello and welcome to this Corona Dialogue special where we are joined today by a very special guest. He's one of the world's leading author surgeons, Dr. Atul Gawande, best-selling author, Boston-based surgeon and professor at the Harvard Chan School of Public Health and Harvard Medical School joins me. Appreciate your joining us, Dr. Gawande. It's a pleasure having you on the show. Difficult times, Corona times, and I know you're at the front line battling it, but wanted to understand right at the outset, a word being used in India and in the US and across the world is, it's time to live with the virus. What do you make out of it when the world says it's time to live with the virus, even as the number of cases and, dare I say, deaths continue to spiral?
Well, I think it's premature. When we see that the number of deaths are climbing and the number of cases are climbing, what I've observed across India, and you look at the trajectory of those cases, is that it's beginning to flatten out. The lockdown is working. This is not the moment to let up. And even if you start opening up, what we're seeing in the United States is people are not going to feel safe and they're not ready to go out. So number one is that we're not ready. It's premature and will only increase the number of deaths, and the economy won't get better. Number two is that we have not started discussing what it takes to be successful as we gradually reopen. We really have to learn the basics of what works to allow people to work together safely. We do know ways to do it, but we're not even discussing that.
What are those basics? Let's start with that, because in a recent article in New Yorker that's gone viral, you've tried to draw on your own lessons from your own experience in a hospital over the last month to write what are the rules of a post-lockdown world. You've identified hygiene, masks, screening, social distancing as the 4 key tenets. Is that enough in your view? Are those the basic rules?
They are. And let me unpack them a little bit for you. First of all, there are people who've been at work through the pandemic and have found ways to be safe, and those are hospitals. Now, some hospitals have not stopped it. The ones that have been able to have had 4 things that we've been using in my hospital. Those are the hygiene, and we all know about hygiene, but understand hygiene means hand washing, disinfection, and you have to do it a lot. Hand washing means more than 10 times a day is necessary to reduce the infection rate by about half. But it works. You have to wash every time you go into an environment with a group of people, every time you leave that environment with people. And if you're in that environment for periods of time, it's every 2 to 3 hours. That's just one of the 4 pillars, and the details matter. Do you want to talk about the others?
Yes, please do. Please do. We
Okay.
want as much information as you can give us about your 4 pillars.
Yes. So that's number one, very basic. All 4 of these, by the way, are ones you know about.
Yes.
But when you put them together and you're serious about it, they work. Number 2 is social distancing. We all know about the 6-foot rule, 6 feet apart. It's not a 6-foot law. The virus can travel beyond 6 feet. 6 feet is what is a practical distance that captures most of the virus. Hand washing works because about 10% of the time you can pick it up from surfaces and touching things and then transfer it to your nose or mouth. Most of the virus spread is airborne. When you sneeze, cough, even talk, you are spreading respiratory droplets. When you sneeze, for instance, and you're at the height of infectivity, it can go well beyond 6 feet. It can go 10 feet. It can go 15 feet. However, most will be avoided by being at least 6 feet apart.
Okay.
Second, and by the way, even talking, loud talking spreads more virus than soft talking. That's the third component. You need masks. That blocks, the number one value of the mask is not that it prevents infection coming to you. It prevents you from infecting others. It's I protect you, and if you wear a mask, you protect me.
Right.
A cloth mask is effective. It's more effective if you have 2 layers, at least double layer cotton. It's even better if you can do 1 layer cotton, 1 layer silk. Having 2 different materials helps prevent when you cough, when you sneeze, when you talk, it doesn't travel 6 feet. It doesn't travel 10 feet. And that makes a big 60% of the population wearing masks that are 60% effective in blocking the droplets will shut down the virus. The fourth component, because sometimes masks are loose fitting, people don't fit them well, sometimes people aren't wearing them, we're not keeping our distance, we're not doing good hygiene, you need a fourth component, and that is screening in the workplace or even in places you go for shopping for whether people have symptoms. So that can be as simple as, in fact, it's probably most important that you're asking, do you have any symptom of COVID-19? And that can include sore throat, can include loss of taste, loss of smell, can include muscle aches, flu-like symptoms, of course, fever, temperature over 100, but then also even just cold symptoms, a runny nose, sore throat. Those are things that that are early signs of COVID. And those are things that mean you need to stay home. In the ideal world, you get tested, but you often don't have access to testing. And so we stay home until we see those symptoms have resolved for at least 72 hours.
From what you've said, Dr. Gawande, I want to come to 2 points. You said social distancing, the 6-foot rule. Now, you know, and you've worked in India, in Dharavi, for example, a slum area, people are living 8-10 to a room which is 6 by 8. How do you then, in an Indian context, actually practice the very basic rule of the 6-foot rule?
Yeah, it is impossible, of course, right? So one of the things that you come to understand is that you are at risk of infecting your family when you develop the virus. Your whole family has to be a unit. You know, I'm with my family and we are together. If one of us gets sick, we all stay home. We don't go out. Now, in lockdown, people are staying together as a unit. It's really about what happens when you go out your door. If someone in your family gets sick, then you're contained there. You know, in China, they had places where people went when they got infected, such as a hospital, or in some places in the US, we're creating separate rooms. The hotels are empty and we're putting people in those locations. But the simple thing is, as a family, you stay together and you think of yourself as a unit. Any one of you gets sick, you cannot go infect others.
The second point, which you said, is if you have any kind of symptoms, stay at home. However, what we are finding, Dr. Gawande, in India, is that a number of patients who turn out to be corona positive in the end are initially asymptomatic. How do you deal with that situation? In fact, in a couple of cases, we found people have tested initially negative for corona and later on found to be corona positive. How do you deal with that situation?
Yeah, there's two things about it. Number one is you are most infective with coronavirus at the moment or even before the moment that symptoms start. There's a significant amount of spread that's called pre-symptomatic, before your symptoms fully develop. And that's why even the mildest symptom means you stay home, you make sure that you're not getting sicker, and you only return to other locations when it's clear that, well, I mean, right now we're in lockdown, but even essential workers, like in the hospital setting, we are asked at the door, do you have any symptoms? Mm-hmm. And you stay home. That will capture about half of the people who could be infected. The other half, you have masks. So we're at work. We have 75,000 people who go to work in my healthcare system, 75,000. And we have successfully prevented the disease from spreading in our hospital through this combination. So if you wear the mask, and we wear it at work all the time, every day, we will, we'll say, hey, dude, your mask is down, cover your nose, please, thank you. And we can, we can joke about it. Like, we're not vigilantes about it, but we've built a culture that says, I'm going to follow these 4 pillars. And that works. We have, out of 75,000 people, 50,000 will show up on a given day. 11,000 have had symptoms and stayed home.
Right.
10% of them, a little over 10%, turned out to have coronavirus. So 90%, it was a cold or whatever. But 10% was coronavirus. And that's why taking it seriously allowed us to stay home and make it work. And then, if you don't have symptoms, you may have coronavirus, but if you wear a mask, you're going to successfully prevent others from being infected. That, as we emerge from lockdown, those are the things we got to learn how to do and learn to be really serious about.
Dr. Gawande, you started out at the very outset by saying it's premature to lift a lockdown, as several countries are suggesting, including a section here in India saying it's time to live with the virus. But is there an ideal time to say, look, this is the time to lift a lockdown, given that the vaccine seems at least a year away?
Yeah, the vaccine is going to be even longer than that away, right? Even if we had a positive test for a vaccine, making it possible to distribute to everybody across the world. I mean, it's taken 20 years of effort to eradicate polio. This is going to be just as hard, right? So we are going to be living with the virus. And these are the steps you learn for living with the virus, right? In HIV, we learned that, you have to wear condoms and you have to ask people to be tested, right? In a similar way, we have to wear face masks and we have to get tested anytime we have symptoms, or stay home anytime we have symptoms until we're clear that those have resolved. And that's how we're going to learn to do it. Now, what's the safe moment to come out? When you see 2 weeks with the cases falling and getting to a low level, when you see that the hospitals have capacity, and ideally when you have the ability to test that you have, that someone with symptoms can go get a test and find out if they have coronavirus, that's the moment you come out. At a minimum, we have to have that curve going down. In India, it's still going up. Now it's flattening. Instead of going straight up, it's starting to curve down, but it's not headed downward yet. And we're still in the range of some 5,000 cases per day. So the U.S. is the worst epicenter in the world. And I remember when we were at this stage, it was only a matter of 3-4 weeks ago. And we, have finally started to crest and come down. I'm begging people here 2 more weeks and we can start to begin to test. And then you open up, gradually. You test out some limited businesses. You start seeing whether people can wear the masks and follow the rules. But we're barely talking about what these core tenets are to make it possibly safe.
So what you're suggesting in a way, Dr. Gawande, is that India also has to be more patient, that while the numbers remain so high, India has to be more patient, because what a group in India seems to be suggesting, or there's a view that our mortality rates are much lower than the US. And because the mortality rates are lower, maybe we are in a better position to open up. You seem to be much more cautious.
Yes. Right now, you have a world where you have, at this point, tens of thousands of people, probably hundreds of thousands, who actively are infected and have the virus. The mortality rate may be lower, but it's still 5 to 10 times the mortality rate of a flu or something like that. If we're talking about thousands of deaths becoming hundreds of thousands of deaths, that will be devastating to an economy. It will absolutely be devastating. The 1918 Spanish flu, which devastated the whole world, the evidence was that if you could stay in lockdown for more than 50 days, those were the places that recovered with the best economy and the best employment 1 year later. This is not just about being able to be good for the economy. It's of course about being able to save lives, but these two go hand in hand. If you want to fix the economy, if you want to get it working again, fix the virus. Those are the things you have to. They don't go. Death is not good for an economy.
You're putting it in plain speaking, and I hope a lot of people are listening to you, because there's an interesting fifth tenet also in your article, culture. You are saying in your article that people are not responsible for themselves, but also for those around them. This is your New York article. That again, Dr. Gawande, is a big challenge in a country like India, where we tend to have a large community gathering, as you know, as a matter of course. How do you then ensure that a community is conscious about its responsibilities to the rest of the people living with them?
What works, and we know this now in the healthcare world, is the debate that we are currently having in many countries around the world is safety versus freedom. Keep me safe. That's your job. Keep me safe versus leave me alone. Let me do whatever I want to do. Both of those are about what other people are supposed to do for you. We are not successful in the hospitals in controlling spread until we have people saying, my biggest concern is I do not want to infect, I do not want to make somebody else sick. I do not want to put them in the morgue. And if we understand, there are hundreds of thousands of us who are circulating who don't know that we have the virus. We don't realize that the symptoms we're able to spread and the symptoms are going to come. And so if I wear a mask and if I'm careful about distancing, and if I wash my hands and I stay home, if I have mild symptoms, I will avoid killing people. My mother is 83 years old. She grew up in Ahmedabad. She's doing well, but she's frail. I do not want to kill her. And I do not want anybody else to. And we have to feel that I never want to be that person. I never want to be that person. So I'm going to do these things. And if we all do that, 60% of us following the basics with 60% effectiveness will stop this virus. So, we need everybody to come along. There's going to be some people who don't play by the games. We don't need to go to war with one another. We need to be able to, laugh about it a little bit and joke and say, hey man, help me out here. Can you just one step back? That'll be cool.
So you're calling
right.
in a sense for a mass education, public education program in a country like India to create this sort of culture in a way. Am I correct? Because you have to create that where people feel responsible not just for themselves, but for the entire community.
This is, yes, and it's not just education. It's about leadership. It's about modeling at every level that I will wear the mask. I will know this information. I will teach my family. I will teach others. If I have a small business, I will ask everybody to do what they need to do. I will make it normal to ask my customers, do you have a fever? Do you have a cough? Do you have any of these things? And if you do, can I ask you to stay away today? And I think at the top leadership level,
right,
showing, we have a big problem where we have our president who is embarrassed to wear a mask. It's a devastating thing to be having to teach a culture while your top leader is unwilling to do it. This is crucial. This is about leadership and being able to show that you will follow the culture, because that's the only way the rest of the culture comes along.
It's interesting that you mentioned the leadership in the United States, because the entire pandemic, in a sense, Dr. Gawande, has put an X-ray on public health systems across the world, especially in the United States. What does your diagnosis suggest? Was the world unprepared for the pandemic or simply helpless?
We were unprepared. There have been countries that have moved faster. I was so impressed that India locked down well before we did in terms of the number of viral cases that were there. And the result is that your curve is flatter. India could be what the US is now as the epicenter of the virus in the world. China was the epicenter. The US has massively eclipsed it. We're well past 1.25 million cases in our country. We have 2,000 deaths a day. It is horrible. It is unconscionable in a country where we have the tools and we have the capability, but we have not built the culture and we've not built the will in the same level. Now we're starting to get there despite leadership that has not been what's required. We've all had to learn as citizens what is necessary, because sometimes the leadership won't be there. And the world is really showing that the ordinary citizen is leading the way. They are staying home. They are learning what needs to be done.
Do you believe, though, as some fear, that a second wave is inevitable? We are hearing about a possible second wave in China, in South Korea, and Taiwan. Especially, as you said, a lockdown cannot be a solution. At most, it is an exercise in buying time. Am I correct?
The critical thing is what you just said. It is about buying time. Have another 4 weeks where India starts to crest, and use that time to increase the testing capabilities. Some countries have used that crisis time well. And then the third part is educate, that all of us are learning how to gradually walk out in the world and take the proper steps so we can protect one another. That will make it easier to open up as all of this happens.
So you're saying use the next 4 weeks to test much more in India, create the health infrastructure in place, be a little bit more patient. Is that what you're suggesting? Don't make the mistakes that we made in the United States, because in the US, several states are already opening up for business.
That's right, and we're going to see the effects of that in about 3 to 4 weeks. It takes, the virus is circulating. It will spread invisibly. It takes about 2 weeks to see those cases climb and turn into hospitalizations, and it takes 2 weeks after that to see deaths rise. When you lock down, within about 3 to 4 weeks, that bends down, and so India is well on its way to seeing that bend down and keep this under control. I think it's about this dialogue you and I are having now.
Right.
How do I keep my family safe? How do I make sure we're not infecting other people? And we know what's required. It's hand washing, it's social distancing, it's masks, and it's recognizing if you have the mildest symptoms, you have a 10 or 15% chance that could be coronavirus, and you could infect somebody. So take care of yourself. Stay home.
Just a couple of questions. Last quick question. How does one remove a certain stigma associated with coronavirus, Dr. Gawande? Because there's a fear factor, there's panic, there's the fear of quarantine. Cooperative societies in India tend to isolate all those who've got coronavirus. How does one how does one remove a certain stigma associated with the virus?
Yeah, and we see it all over the world. Number one is you can't punish people for revealing that they have coronavirus. We have to ask people to be safe and to follow the norms that we're finding are the ones that help us be successful. But we send a terrible signal when you start to make people feel that they can be jailed or they can be locked away. We need to enforce. We need people to self-quarantine as much as possible.
Right.
We're not going to be able to completely just control everything. Some people have proposed that you create camps for people that they get sent to. We don't even have the testing to know who should go and who shouldn't go. 90% of people who are going to have symptoms that seem like coronavirus is not coronavirus. And so if we're going to get everybody to cooperate, we've got to make it just normal. You don't go to work.
Right.
We will give people the time off to be at home when they get through it, and then we welcome them back when we know it's safe.
Very quickly, the post-corona world, are you talking therefore of a new normal, a reset? Let's say flights are there tomorrow, you'll have to fly with face shields possibly and go through various checks. When you go to office, you'll have to come to office in a mask. You'll have to have social distancing in public transport. Is this going to be a new normal till we get a vaccine, or do you see it even stretching much longer?
It will, yes, this will be the new normal. It'll be like after 9/11 when you suddenly have to take off your shoes and go through metal detectors and those things to be safe on planes. And suddenly we find that this is the next thing we have to have. But if we want a functioning economy, this is how we start to go on offense against the virus. Yes, these will become the new normals, and we will be learning from one another. We will be figuring out how do I open restaurants, right? In Hong Kong, all of us are watching because at restaurants, no mask, no service. You go, you sit down, mm-hmm. You're allowed to take off your mask to eat, but then when you stop eating, you put your mask back on. Does that work? Is that going to keep people safe? We're going to find out.
Therefore, let me ask you in conclusion, Dr. Gawande, this has been fascinating listening to you. What's the biggest learning for you as a doctor that you might want to leave your viewers and readers today in India with? What's been the biggest learning over the last few months?
A couple of things. Number one is that we are learning at hypersonic speed. It is amazing, right? 5-6 weeks ago, I couldn't have told you how much value masks had. I couldn't have told you whether putting these things together works. And we learned from Asian hospitals that were successful. We translated that into US hospitals where now we have too many cases, and so we're teaching the rest of the world what else can happen. And it's spreading, right? It's spreading on Twitter, it's spreading on Facebook. We're all learning at hyper speed, and it's amazing to see the entire world tackling something and seeing it change. For that reason, I also think that that we are going to, the second lesson is that we're also learning what can work to be therapies and vaccines against the virus. I think it will take a long time to distribute and just create enough supplies of what works. But I think in the next few months, but it will be months, we will be learning what is the combination of therapies that make it less deadly and therefore make it feasible to control better. We will get a vaccine, though it may take the year, and then we'll try to drive it into production. The world is, there's a ton of conflict, there's a ton of anger, but for the most part, what I see is a world that is moving in ways that have brought the virus under increasing control. The global spread is flattening, and that's a remarkable thing. And I think we will manage together in this way over the next year.
Well, Dr. Gawande, this has been an education. There's a world, as we call it, before Corona now and after Corona. And you've given us a sense as to what this world will be after Corona. Dr. Atul Gawande, your experience, your expertise, thank you very much for sharing it with viewers here in India. Stay well, stay safe.
Thank you, Rajdeep.
Thank you. That's it on this Corona Dialogue special this weekend. As always, we get you some of the world's finest minds here on India Today. Thanks for watching. Bye for now.
Hi everyone, Preeti Chaudhary here. Hope you like this video. For latest news and analysis, like and subscribe to the India Today YouTube channel. And don't forget to press the bell icon to stay updated. Thank you for watching.